Hello everyone. So today my first part is going to be basically just 45 points of counseling, which is one of the most important aspect of this tutorial of this session, and of course the whole course. So if you can really understand the technicality of cross cradle hold in 45 points, 90% of your problems will be solved 90% of the time. Okay. So do kind of listen to this very carefully, watch it, and then practically you can just buy a doll and make a breast model at home and you can practice it the model. But also kind of help any mothers in your family who are just delivered, or teach any pregnant mothers, when the baby is born, you practice on mother and the baby, because more you practice on a live baby and the mother, more efficient you will become. Okay. So let us start with the first point. Of course this is part 1 and we are going to talk about, I will be including part 1, part 2, part 3, basically a continuous process, and I will make it as elaborate as possible and also as simple as possible. Okay. So let us start with cross cradle hold and 45 points of counseling. Okay. Now first thing that we want to remember, we have this thing in our mind that when is baby ready to breastfeed. Okay. And most of the time mothers feel that, oh, when baby cries, that is when baby is ready to breastfeed. One point you want to remember, by the time baby cries, it is already too late. Okay. So please do not wait for baby to cry. Okay. What you can do is to understand those early hunger cues. Okay. So early hunger cues, so what are those early hunger cues in newborn babies or babies who are small, 2 months, under 2 months of age, is basically they will, first thing they will do is they will open their eyes and they will kind of squirm. So they will kind of squirm, okay, and they will start looking around, they will start looking for breast, so they will open their mouth and then they will move around like this. Okay. So that is important. Third point would be basically, what they do is that in mid hunger cue they put their hand in the mouth. So they will put them hand in the mouth, okay, and they will basically kind of salivate and they will become little bit more kind of squirmy. So they move a lot, okay. Third stage, they become very irritable, they become, it is a late cue, they become very irritable, they start crying and they are very difficult to console them. Okay. So when do you want to breastfeed? You want to breastfeed when they are in early hunger cues. So in early hunger cues again, they will start squirming, okay, they will open their mouth and they will start looking for breast. So that is what is the most important early hunger cues that you want to understand. So here now you have a baby who is small, and suppose baby does not wake up say within 2 hours or so. Now again, if the baby is small, you want to have a catch up growth, then I do recommend that you should basically wake up the baby after 2 hours gap in the daytime. Okay. So the way you wake up the baby is basically you remove pretty much all those blankets, you remove cap, you remove mittens, you remove socks, because when the baby is wrapped too many times, they are too comfortable and sometimes they just do not want to wake up. So once you remove all that extra clothing, baby does get kind of uncomfortable and then they wake up. Okay. Second thing what you want to do, suppose if they are not waking up, okay, even if you removed all the clothes just with one onsi, you can keep that onsi on. If it is cold, obviously you can put one more layer, but do not put too many blankets around the baby, okay, when you are waking up the baby. Second thing what you want to do is to basically make the baby sit. So what you can do, you make the baby sit on the lap, okay, put your fingers on the jaw. So there is an angle of the jaw, so here is the angle. Okay. So you basically put the hand around the jaw, okay, it should not be on the neck, it should be on the jaw, okay, and then your wrist is basically resting on the chest. So the whole body, basically the body is resting on your palm, okay, and the other hand is just basically behind the back of the baby, okay. So and then you just kind of tilt the baby a little bit forward. When you tilt the baby a little bit forward, what happens, the stomach gets pressed. So here in this position, okay, so this is a perfect position to wake up the baby. Now I like this position a lot even for burping the baby. So remember to kind of make the baby sit. See here, do you see how baby is kind of bent forward a little bit? You do not need to pat the baby or you do not need to move your hand, just kind of support back like this, okay, and in front it should be like this. Don't hold it too close, just it should be just kind of near ears. Okay, so I am holding it near the ears, not on the neck. You do not want to put your fingers on the neck, because what happens is in the neck you have arteries. So you do not want to press your neck, baby's neck, you know, that it will cause problem. Okay, so just on the jaw, on the mandible. This is a bone called mandible. So you want to touch near the mandible. Okay, so now if baby is hungry, baby will immediately wake up. The first thing baby does when you put them in the sitting position, they open their eyes. So they open their eyes wide open, okay, and then you kind of stimulate little bit, and that is when baby kind of is ready to breastfeed. Make sure that you do not put the baby on the breast because baby is sleepy. If baby is sleepy, they will just go back to sleep. Okay, so if baby is not waking up, just put the baby back, and again you can try and within a half an hour or so. Now at night I do recommend that baby should be breastfed at least 3 to 4 times. Now at night, if baby is not waking up after 3 hours, then I would wake up the baby at around, say, at the end of 3 hours, you know, because you do not want to go too long, because then again, you know, I see that babies do not then put on good amount of weight. Okay. So that is one important point that I want to discuss. Now mothers preparation. Okay. Now what is mother's preparation? So before basically kind of holding the baby or touching the baby, what mother needs to do is to wash her hands. Really important, because kind of mother has touched so many surfaces, you know, mother has probably changed a diaper, mother has done so many other things. You want to make sure that she has clean hands before she touches the baby. Okay, so even before she picks up the baby, I mean, remember I talked about the early hunger cues, so that mother, this is just the thought process that mother is going through. So this was the thought process that I mentioned, that she should know when to start feeding the baby. So if she feels this is the time to feed the baby, to wake up the baby, or baby is squirming, the first thing she does is wash her hands. So before she touches the baby, tell her to wash her hands with soap and water. Okay, little bit warm water if she has access to warm water, that would be great. If she does not have warm access to warm water, then it is fine too. So use soap and water, wash her hands, and then tell her to drink 1 glass of water. Okay, so that is about 8 ounces, 250 ml of water. Now this water has to be clean. So if you have access to filter water, of course that is the most preferable one, but if you do not have filter water, what you can do is to just kind of tell mother to boil water and then just keep it at a room temperature, and then so boiled in kind of room temperature water, that she should have it immediately before breastfeeding. Now why this is important? Because as you know that mothers get very busy, and when she has a small baby, she has to feed every hour and a half, 2 hours, you know, then she may have to do some work at home, she may have other children, you know. Lot of time what happens, she forgets to take care of herself. And here in this situation, when she is probably getting 750 to 850 ml of milk, and sometime if baby is catching up, then she will get even 1 to 1.5 liter of milk. So if the latch is good, the weight gain is so good that definitely mother gets more than 1 liter of milk, and if you have twins, then she will probably get 1.5 liters of milk. So in that scenario, even with singleton baby, I do recommend that mother should sit down, relax, and drink some water, because if she drinks her water, what it's going to do is it is going to relax her, plus it will hydrate her. Because as I mentioned, they get so kind of worked up that they forget to drink water, they forget to eat their food, you know. Mothers, they get mad really, new mothers, you know, even worse. So just make sure that you mention to her, kind of counsel her, relax, drink water, 1 glass of water, take a deep breath, think about good things, because it oxytocin release, you know, this is the hormone which releases your kind of milk from breast, releases milk, right. So that for release of, it's called let-down reflex. So that let-down reflex, you need a hormone called oxytocin. Okay, oxytocin is also called love hormone. Okay, and you need to have that relaxation. That's when mother will feel loved. She will have this kind of motherly feeling, and immediately she will relax and the milk will come out. So for that also I recommend, just tell her to relax, think of some good things, think of, you know, if she wants she can listen to some light music if she has access to, or don't be on phone, keep that TV away, not all those lot of activity surrounding her. Okay, so there we are. Now she drank water. Now what she has to do, she has to basically pick up the baby. So if she, suppose baby is sleeping on the bed, of course I do recommend that if mother can sleep on the floor with the baby, that would be great, because a lot of time when the baby is sleeping on the bed, there is a risk of rolling down. So I personally do recommend that when the baby is small, it is better to kind of be on the floor on the bed, much better. So now she is sitting down, okay. She has a baby next to her. So first thing, obviously baby is right there, so she does not need to walk and get the baby, but if baby say in the crib or say in the jhula, she will have to bring the baby, she will have to kind of put the baby next to her while she is preparing to breastfeed. But remember, she has to touch the baby only while after washing her hands and drinking some water, okay. So now here I have got the baby out of jhula and I am ready to breastfeed on my bed, okay. So I am going to put the baby in front of me, okay, and I am going to prepare myself. The way I am going to prepare myself is, first I am going to find a comfortable position to sit, okay. So if it is a bed, then I can sit on the bed. I have to make sure that I have a pillow behind my back. If I do not have a pillow, at least I need to have a wall or a kind of a board of the bed where I can rest. Pillow will be great because that will kind of give me comfort on my back. Say for example, I am a mother. So and then another thing what I want to do is I want to kind of relax, kind of fold my legs. If I am sitting on the chair, then I can put my legs down, but I want to make sure there is a support under my feet, okay, because the feet needs to be supported. If it is dangling in the air, it will be very uncomfortable for the mother. So make sure that we have a support under the feet, okay. So here now I am ready to breastfeed. Here I am sitting down with my legs folded, with back supported, back straight. Very important that you keep your back straight, it should not be drooping down, or it should not be very kind of stressed. Just relax and then just prepare yourself, okay. Now next point would be to open the clothes, okay. So one thing which is very crucial, most of the mothers that we see, they have this habit of wearing bra and shirt which are basically not front open. Lot of time they wear a kurti, but then they just lift up the kurti and lift up the bra. So what happens, like for example, I am going to show you on this breast model. So here is the breast model, and what is happening is mother is kind of lifting up the bra. So now that tight bra is sitting on the breast, okay, it is basically kind of denting on the breast. What is happening when you have something which is pressing on the breast? So here we have milk is formed in the alveoli over here, and then milk is kind of flowing out or kind of getting collected in the collecting duct. So when you have something pressing on the collecting duct, duct means like a canal where the milk is coming out, and if something is pressing on the duct, what will happen, the milk will form, but it is not flowing out. So now the milk will continue to form in that cells. I mean, I am not going to use too many of this medical terms because I know many of you are not medical doctors or nurses. So again when the milk is forming and that milk flow does not have a proper way to come out, then milk will continue to form, and then it will become bigger and bigger, and that area will become inflamed. It will become red because the milk is not flowing out, it is just collecting in one space, okay. Now what will happen, mother will kind of feel swelling in the breast, and then if suppose that swelling is not relieved, then what will happen, eventually the infection will set in. Once the infection sets in, then they develop breast abscess, and once the breast abscess develops, then you see she has to go to surgeon will kind of cut the abscess, remove pus from it, and it becomes so painful, and many times then mothers stop breastfeeding on that side, okay. So this is another very important point, and our 45 points we have created, this is so that to prevent any complications in the future, okay. So this is another important point, is to tell mothers that not to press anything on the breast. It should not, there should not be any tight clothing, there should not be any tight bra. If she wants to breastfeed, tell her to buy clothes which has buttons till the navel, and she has to remove each and every button, okay, and then basically make sure that she does not wear bra if possible. If she wears bra, then she can just remove the button and keep it completely open, at least till while she is breastfeeding. At that for say 30 minutes, 40 minutes when she is breastfeeding, tell her to just remove it. It is much easier to do that, okay. Then she will not develop any of this complication, okay. So now she is prepared. she's removed her breast, she's opened her breast, nothing is pressing on the breast. Now she's going to take the baby, okay. So here it is that here she's going to take the baby, okay, and then she's going to kind of remove all the clothes and just keep one onesie or just one pair of clothes. If it's cold, then of course second layer is fine, cap is also okay, but I prefer that while mother is latching the baby, or at least while she's learning how to latch, remove the cap, because it will be much easier for her to kind of hold the baby and learn how to latch the baby or how to position the baby, okay. So that's really important. So again, can remove all the blankets, remove cap, and then wake up the baby by putting the baby in a sitting position, kind of hold it little bit forward, and then now she is ready. So now what she is going to do, so here is the baby. First thing what I am going to do, now remember that baby does not have neck control in first 2 months of age, okay. So she will have to continue holding the head, okay, so that baby does not have a wobbly neck, okay. So here now what she is going to do, she is going to basically hold the baby from the back, okay, and then here she is going to support with her elbow joint, okay. Now I am going to discuss this. This is called positioning of the baby, because mother is now ready to breastfeed, okay. So mother's preparation is done. Now what she is doing, she is now positioning the baby, because this is very important aspect, because here now what we are doing, we are landing the baby to be ready to breastfeed. So this is called landing the baby, also called positioning of the baby, okay. So now this is the cross cradle hold. In cross cradle hold what happens, suppose I am going to breastfeed from left side, that means this hand is going to be open, okay, but I am going to hold the baby with the opposite hand. This is called cross cradle. So the hand which is in cross to that breast that I am going to breastfeed from, I am holding the baby from that side, that is why it is called cross cradle. So now first thing what I am going to do, I am going to put this baby's legs under my armpit. It should be really kind of embedded, make sure that it is held tight, because a lot of time what happens, if it is not held tight, what happens, baby keeps slipping. When baby keeps slipping, then it becomes very difficult for baby to latch on just by mouth, okay. So to have a good latch means holding the breast with the mouth, okay. So for that, to have a good holding of breast by baby's mouth, you want to have a perfect position. If there is a perfect position, it will be very easy for mother to latch the baby, it will be very easy for baby to get the milk transfer, okay. So first thing you want to do is you lift the legs up under the armpit, and you basically what you can do is to put baby's hip little bit on elbow joint. So this is what you want to do, is put the elbow joint just at the angle of the elbow. So here this is ready, and make sure that both the legs are held properly. Now look at the position of the baby, okay. Now position of the baby is absolutely horizontal. Do you see, this is absolutely horizontal. A lot of time when I see mothers, they do this. Now this is not horizontal, this is diagonal. So you do not want a diagonal baby, you want to have absolutely horizontal position. Here what I am doing now, look at this. Now there are 4 important points of positioning. Remember that it is WHO for positioning point. One is that baby should be in a straight line. So do you see, baby is completely in the straight line. What do you mean straight line? Straight line means the neck, okay, here is your ears, then your shoulder and your hip, they all are in the straight line. So here in this position, suppose this is a straight baby, okay, this is a straight baby. So here in straight baby, what is happening, ears, shoulder joint and your hip joint is in the straight line. So exactly when I put this baby like this, so same thing, ears, shoulder joint, okay, this is shoulder joint and your hip joint are in the straight line. So this is what I mean by straight line. Many times what happens, babies are put like this. Now imagine you are eating food, and if you are putting your head sideways and you are eating, you will not be able to swallow, you will not be able to eat. But when you see many mothers, they breastfeed the baby like this, the position is like this, ears are in front, okay, shoulders on the side and the hip is on the side, and this is how so many mothers breastfeed. So if you now look at any mother, immediately you should look at it whether in the straight line or not, okay. So this is how many mothers breastfeed, it's so common, and that is why so many mothers, they can't even, babies can't even breastfeed. It is like we cannot eat like this sideways, okay, we have to keep our body straight. Similarly, same thing happens. So, you make sure that baby is in straight line. So, here baby is in straight line now, okay, and if I bend it backward, there you go. So, this is the straight line of baby's body. One more time, ears, shoulder joint and your hip joint, straight line. Alright, now what is happening? So, now baby is in a straight line. Now there should be full body support. Imagine that you eating, adults are eating and you are hanging in the air. You will not be able to swallow, you will not be able to, it's kind of a very scary situation where you do not have support, right. What support do we have? We have gravity support, right. So, when you have a gravity support, basically you sit, you can sit properly and you can eat well, right. Similarly, here baby is against the gravity, means if you do not hold the baby, baby will immediately fall, right. So, in this position you want to make sure that you hold the baby, full body support is extremely important. So, what you can do, full body support, look, the legs are supported, right, the hip is supported, right, and back is supported with my hand and the neck just a back part of the head is supported also, right. So, this is important, that keep the body, full body support is extremely important. Alright. So, that is your second point. So, one more point in positioning is like when you bring the baby to the breast, okay. So, we already spoke about straight line, tummy to tummy or chest to chest and then nose to nipple, I would say neck to nipple. One more thing you want to make sure that many times mother has this habit of kind of drooping forward. So, kind of tell mother not to bend forward. Lot of time what happens is baby is on the pillow and she is bending forward. What she has to do? She has to sit straight and bring baby up, okay. So, that is important, that is to bring baby up, do not droop down, do not kind of stoop down, okay. Second thing is where you hold the baby from head is very important. Many times what mothers do, they hold the baby like this. This is not the way to hold, because what happens when you press the head like this, again the neck will get bent forward, okay. So, you do not want to have a neck forward like this, you know, you want to have a neck backward. So, the way you hold it, there are two bones over here. So, you want to basically mastoid bones they are called. So, you basically touch or hold on the mastoid bone and then put your fingers just around it, not on the back of the head, and then you bring the baby neck to nose. So, neck to nose. Why neck to nose? So that your neck is bent forward. If you bring nose to nipple, what happens? Basically your head would be straight, you know, your neck would be straight and you want to bend it a little bit backward. So, you bring the neck baby a little bit downward. So, that way when I open the mouth, that is when the lower part of the radula go in the mouth. I will again discuss it why that neck to nipple is very important, because that is called landing of the baby. Third point, you keep the baby so close to the mother, okay, you tell mother that keep the baby's kind of chest close to mother's chest, because if baby is close to mother's chest, it will be so much easier for baby to latch on well, because if baby is too far, for example, if the neck is twisted, then what will happen? The chest is facing up. It should not be facing up, it should be facing the mother, okay. So, baby should be extremely close to the mother, and this is how basically baby will come. Now, the fourth point of positioning is nose to nipple. Now, that is also again WHO point, very important, nose to nipple, but when you bring the baby to the nipple, you want to make sure that nose is near to nipple. Now, what is this near to nipple? Near to nipple is, what you can do is, suppose for example, you are bringing the baby to the breast, okay, to the nipple, then the near of the nose is facing the nipple. So, that is very important, I will talk about it later why it is important. So, here for example, I am going to show you again. So, in this position baby's neck is extended and baby is facing the breast directly, baby is not facing up like this, make sure that baby's face is not looking at the mother. Again, when we are eating food, we always look at the dish, we do not look up, right. Do we look up when we eat? We always look in the plate. So, baby's plate is mother's breast. So, let baby look directly at the breast and then you ask baby to look up, not you can't ask baby, but just basically what you want to do is you lift up baby's neck backward. Now, why is it important to lift up the baby a little bit backward? This is because what happens is, while you are drinking water, okay. So, when you drink water, remember that we always kind of lift up our neck a little bit and then drink water, right. So, if you have a bottle, you always kind of lift up your neck and then drink water. If we have water and if we kind of say put our head forward, we will not be able to swallow. This is really important, because if we do not do that, we will be able to, if we do not extend our neck, then we will not be able to swallow. Similarly, when you are bringing the baby to breastfeed, it is important that we extend the neck backward. Okay. So, here it is, extend the neck backward, okay, and this is how it should be. Do you see? And make sure that the nair of the nose is in the line of nipple. If it goes too high up, like if it is coming too high up like this, what will happen? Then baby will have to bend forward to breastfeed. So, you do not bring the baby too high up, bring it baby little bit lower. So, baby has to extend her neck. Okay. So, in this position, you pull the baby's leg little bit downwards towards the other side. So, baby will be able to extend the neck, or you will have to help baby to extend the neck, and then to reach out, basically baby will kind of latch on. So, this was the two parts that we talked about. First part was mother's readiness, second thing is baby's position. So, this is where we complete our first part of how to position the baby to the breast. Okay. Thank you so much.